Great, welcome back to the House Healthcare Committee. We are now turning to our wonderful legislative staff to walk us through the various reports from last biennium and potentially some that come every year, every session, reports that come to our committee. This is a very dry topic, but it's really important in that we know what is coming in. And as Ameren and Katie walk through it, I will try to highlight the ones that I think we will be definitely taking up. So to maybe highlight those for you all. And then obviously it's important. People spend a lot of time putting the reports together. It's really important we read them, at least the executive summary, just to get a feel for what's happening and ensure that, if we have follow-up questions or actions that need to be taken, that we are doing that as we sit here today. So we'll get started. Feel free to ask questions, but it is dry.
I'm going to share my screen so you have a list of reports. Success. Okay. Oops, not up there though. There we go. Okay. Katie McGlynn, Office of Legislative Counsel. So we've put together.
Okay.
I lashed in my eye just as I started talking. We've put together a sort of table of reports due into this committee. We've arranged it in chronological order of when the reports are due. Hopefully that makes it easier to sort of have a sense of, the order that things are coming in. And this captures the reports that have come in since the General Assembly adjourned last May. So you'll see that you have some reports that came in this summer. Other things to tell you, we've added hyperlinks. So if a report has come in and it's on the General Assembly website, hyperlinked it so you can go right to that report. You will notice that a very popular report date is January 15th. So there are a lot of reports at that time, and there are probably still some that were due on January 15th that are still trickling in. So we can update this table as more reports come onto the website.
Can I ask you a quick question?
Sure.
What does it mean if it's not hyperlinked?
That means we didn't have it on the website.
So it's not up yet, or?
Not necessarily. It could be that it wasn't submitted. But has anyone showed you how to find reports on the website? Would you like me to do that?
Great.
Okay. Let me stop sharing this document.
Is that the find reports page?
Yep.
I think the chair sent that out to us, didn't you?
I did send that out, but it didn't say where to find it. I just sent the link.
Where is it? Right there. Okay.
I still didn't see.
Let me try to share this screen. Okay. So this is the General Assembly website. And there is a tab right here, Reports and Research. I'm going to click on that. And then it says Find Legislative Reports. Click on that. Is it following along with me? Great. Okay. And let me just close out of this. And so this is the order of reports as they are received, that they're just being posted. There's a person in drafting operations staff who's posting them as they're submitted. So there's no rhyme or reason to these besides the submission date. But you can do a word search. So if you wanted a report from the health department, you could type in Department of Health in this search box. If you know there's a report coming in on psychiatric care and emergency departments, you could search under, psychiatric care or emergency departments, and hopefully one of those words would bring up the report you're looking for. So this is what we're hyperlinking to, these reports.
Great, thank you.
Okay.
So can I ask another question? Sorry.
Sure.
So this is only reports that were required in statute, like Ina was talking about a report from the healthcare reform group. That would not be here.
If it was to be submitted, if statute required that it was submitted to this committee, it would be here. The one exception is, I think we'll note it when we get there. There's one report that Senate Health and Welfare just requested. They didn't put it in statute, and I've included that report here. So that's not a statutory report.
I tried to search and couldn't find it, yeah.
Healthcare Reform Oversight Committee does it.
Yeah.
All right, are we ready to get started?
Yeah. Let me go back to my page. turn it over to Amber.
For the record, Amber Abergele, Legislative Counsel. I have most of the reports on the first page. So, beginning with a couple quarterly reports. First, quarterly Choices for Care report. This is just a one-page report for planned and actual expenses. For those who are less familiar with Choices for Care provides a package of long-term services and supports to Vermonters who are aged 18 years and over and need nursing home level of care. Next is the Medicaid program enrollment and expenditures quarterly report. This, as you might be able to tell from the report title, just says how many people were enrolled in the Medicaid program and what the expenditures were for the quarter. Next is the receipts, expenditures, and balances in the Health IT Fund. This is an annual report due in September. The Health IT Fund is a special source of funding for medical healthcare information technology programs and initiatives, specifically those described in the Vermont Health Information Technology Exchange Plan, also known as the HIE plan.
And if I can just stop you there real quick. So we will have Vital come in who will talk about the HIE plan as well. And I believe there are some sunsets for the HIT fund. So this might be something just to peruse before, we might get to that.
All right. Next is a one-time report, costs and contract staffing for private non-medical institutions. So the Department of Vermont Health Access has responsibility for setting and maintaining rates for private non-medical institutions, of which there are 12 programs in Vermont offering residential care to youth and adolescents. Next is the annual Bill Back report, an annual report from the Green Mountain Care Board. For those of you that don't know, the Green Mountain Care Board is able to bill back to hospitals and insurance carriers the cost of certain activities related to the healthcare system oversight. So this report each year says how much money the Green Mountain Care Board has billed back and how their funding worked for the year. Next is the Global Investment Report. This is an annual report from the Agency of Human Services. You've heard probably a lot over the last few days about the global commitment and the 1115 waiver, as you've heard from the Director of Healthcare Reform. So this is a report that outlines all of the investments that have been made under the Global Commitment Agreement.
Next, you have the report from the Health Equity Advisory Commission. If you remember when we walked through the acts that were passed, there's Act 33. They dealt with creating the Health Equity Advisory Commission. They have to do an annual report. This is not their annual report. This was a one-time requested report, and it dealt specifically with continuing education and cultural competency as one of the possible topics for continuing education.
Next is the Pharmacy Best Practices and Cost Control Program Annual Report. This is from the Department of Vermont Health Access. It covers issues related to drug cost and utilization, effect of national trends on pharmacy programs, comparisons to other states, DVHA's administration of the pharmaceutical assistance programs, use of prior authorization requests, regulatory efforts, and other drug categorizations. The next two are those quarterly reports, once again, one Choices for Care, the other for Medicaid program enrollment and expenditures. Then we have the Prescription Drug Cost Transparency Report. This is a report regarding prescription drug costs, specifically the increase in prescription drug costs. And the report focuses on information provided to the Office of the Attorney General by DVHA, Blue Cross Blue Shield of Vermont, and MVP Healthcare. Next is a one-time report from the Insurance Parity in Residential Care for Children and Youth Working Group, which was established in Act 137 of last year. So this is increasing appropriate residential treatment to children and youth enrolled in commercial health insurance. The report is about examining the barriers and proposing solutions in this area.
So I'm sorry, can I just stop there? So this would be something, to Leslie's question, that if we wanted to find it, we would do what?
In this instance, I would look again to make sure that we can't find it on the website.
Okay.
Looked a couple times and we're not able to find it. Then I would probably check with the committee assistant to see whether we received a copy here that just for whatever reason never made it to the people who post it.
Gotcha.
And if we can't find it anywhere there, then we might start reaching out
Okay,
elsewhere to the working group, I guess.
Whatever department
Would be doing that.
assisted the working group.
okay, thank you.
Sometimes the title of the report that comes in doesn't match our record in statute of what we think the report will be called, and sometimes that mismatch doesn't get corrected.
Okay,
So next, there is a standing emergency medical services advisory committee, and they're required to do an annual report, and this is the annual report coming in.
Next is the Office of the Healthcare Advocate Annual Report. And following that is notice of introduction of new high-cost prescription drugs. This is posted on the Office of Attorney General. It should be posted at least quarterly. And next is a one-time report, impact of prescription drug costs on health insurance premiums. This is submitted by the Green Mountain Care Board. And just to note, this is the state's fully insured major medical health insurance market that they're looking at when looking at how the premiums are affected by prescription drugs. So that's large group, small group, and individual markets. Next is the unused drug repository. This is a report that is produced upon request of the Senate Health and Welfare Committee, an analysis and recommendations regarding the implementation of an unused prescription drug repository program in Vermont.
Next, we have two reports related to the work of the Health Equity Advisory Commission. First, we have the annual report. We expect that every year. And then there is a one-time report. Oh, excuse me, this was annual. There's an annual report that's coming in from the Department of Health, and the request is that the Department of Health analyze health equity data using the smallest feasible units to detect racial and ethnic disparities. So that's an annual report. It was part of Act 33, and that has come in.
and the Health Equity Advisory Commission, I think this is the one where we got notification as chairs that it was going to be delayed. Right, I think
Next on the list is operation of wholesale prescription drug importation program. This is a report requirement that will or would be due annually once this program is operational, which it is not. So that is why there is no link here.
There's also an annual report on the extent to which individuals with a mental health condition or psychiatric disability receive care in the most integrated and least restrictive setting available. This asks the department to look at a number of factors, including adequacy and capacity at each level of care, individual experience of care and satisfaction, and then performance of the state system as compared to nationally recognized standards of excellence.
Next is an annual report from the Vermont Information Technology Leaders, also known as VITAL. Then there's also a Green Mountain Care Board annual report. And then a healthcare expenditure analysis report. This is from the Green Mountain Care Board. It's also an annual report. It outlines all of the healthcare expenditures for the past year. Next is the Clinical Utilization Review Board annual report. This is submitted from the Department of Vermont Health Access. It's an annual report. For background, the Clinical Utilization Review Board is required to make recommendations to DVHA on matters pertaining to coverage, limitations, place of service, and appropriate medical necessity of services in the state's Medicaid program.
The next reports at the top of page 3, I sort of think of them as companion reports because they're reporting on the same topic. Administration of involuntary non-emergency psychiatric medications. One report is conducted by the Department of Mental Health and the other one is conducted by an independent consultant. And those both come in annually. Next, there is a time-limited annual report. This is the last time you'll be receiving it. Data on patients seeking mental health care in hospital settings. It addresses the number of patients seeking involuntary care, the number of people in temporary custody, length of stay at emergency departments, and data on emergency and voluntary procedures.
I'm just, sorry to keep interrupting, but we did receive notification that will also be a bit delayed. So we have not received that yet.
Next, another time-limited annual report, but this one you'll be receiving until 2025. An update on progress addressing the CMS requirement to reduce federal Medicaid spending on IMDs, which is institutions of mental disease. That's a federal term, not our term. So a requirement to start reduce our reliance on that federal money for particular facilities that are classified as IMDs. So you'll be getting that report from the Agency of Human Services. There is the final report of the Mental Health Integration Council. The goal of that council was to help ensure that all sectors of the healthcare system actively participate in the state's principle for mental health integration, and as envisioned in the 2020 DMH Vision Report. So you've received that.
Next is the prior authorization gold card piloting report. This is a report from our health insurers. And Act 140 of 2020 requires certain health insurers to implement a prior authorization pilot program. So the act requires participating health insurers to report on the pilot program results, including an analysis of the costs and savings, among other things.
Can we revisit Act 114 at the very top of this spreadsheet? There's a section 5 and a section 6. Without having either of those open right now, I believe one of them from Flint Springs is the consultant. Can you confirm that that hasn't sunset?
I can look into that.
I think it did last year.
Okay,
They submitted it last year, but I don't think that they have to submit it this year.
thank you. I will look. And you think that's the case for both? For Flint?
No, I think that's the case
Just for Flint Springs?
for Flint Springs, but I think section 5 is ongoing.
Okay, I will
Don't
double
quote
check
me
that.
on that, but
Yep, I will take a look. Thank you.
And on the prior authorization gold card piloting, we will be looking at prior authorizations this year. So that's one to take a look at.
Okay, next was the final report of the Forensic Care Working Group. 2 years ago, the legislature created a forensic care working group. The idea was to look at a facility potentially for individuals who were involved in the justice system and maybe experiencing mental health symptoms that perhaps impacted their competency, and looking at other alternatives besides hospitalization for these individuals. So this group was addressing whether there's a need for a facility and any related recommendations, and that report has come in.
Next is a report from the Department of Financial Regulation, Medicare supplemental coverage and Medicare Advantage plans. This report looked at, among other things, whether Vermont residents are receiving accurate information about Medicare supplemental coverage and Medicare Advantage plan options and sufficient assistance with selecting products that are in their best interests, and if not, how to best remedy that situation.
Next is a mobile crisis needs assessment. This pertains to psychiatric mobile crisis needs. There is a report that's required of DMH, it's federally required, and it has to do with the mobile crisis state planning grant. So the request in legislation was that federally required report come to the General Assembly as well.
Next is another report from the Department of Financial Regulation. This is on pharmacy benefit management, and the topic of the report is to study certain issues related to pharmacy benefit managers, also called PBMs, which act as an intermediary between health plans and pharmacies, and they'll deliver a report with findings and recommendations on PBMs. And then next is the Department of Financial Regulation again with another report, this time on unmerged individual and small group health insurance markets. You heard about this very briefly when we did our Health Insurance 101 yesterday. So there'll be a report on what to do next.
Yes.
Could you help me with a tutorial, if you have a moment? I'm interested in the Medicare supplemental coverage and Medicare Advantage plan report, but I just went to the website and put in Medicare and got nothing. So I'm just wondering how to find that.
That's a great question. I suspect since January 15th was the weekend and then we had a holiday on Monday, that there may be a backlog and what's
Okay.
being posted. You'll see, we probably have 2, 3, maybe 3 pages of reports that were, due January 15th.
Sure.
So we can either wait and see, or we can check in with DFR to see if
That'd be
that's
great.
coming.
Because that's sort of crucial, I guess, this Medicare Advantage problem.
Daisy?
I don't know if the chair would like to comment on process, but there was a report I was looking for last week, and rather than reaching out directly to the department at AHS, I reached out to, they have a new role called Director of Communications and Legislative Affairs in the central office, and it's Rachel Freeman, I believe. And she was willing to be point of contact for helping us to reach out and locate legislative reports.
Great.
So I don't know if you want us to.
You can go directly to her, you can ask legislative counsel, or you can ask Claire to help. I definitely would not go directly to the commissioners of the departments. But if you have Rachel's contact information handy, Daisy, that you could send out to everyone, that'd be great.
Yes, and it's in the, I'll re-forward, someone sent us the list of contacts at
Great.
AHS.
Thank you.
Really helpful, thank you.
And just keep in mind that, well, where the reports are originating from. While many of the departments that you deal with here are within the Agency of Human Services, you will have a few, Department of Financial Regulation being one, that are outside that agency, so they probably won't be able to help you in that respect. But they'll let you know if you come to them and it's not one of theirs.
And feel free to come to me and Claire as well, and we'll help track things down.
All right.
And so, sorry, back to the unmerged individual and small group markets, we did discuss that we will need to make some decisions on that this year due to the subsidies that are coming through. So just pointing that out as we walk through these.
The next four reports all deal with Act 187, which I will be doing a walkthrough of next.
167.
Yes.
Yes.
Act 167. And you heard from Ina Backus, you heard a little brief bit about parts of Act 167. So the first report is development of proposal for subsequent all-payer model agreement. That's going to be coming from the Green Mountain Care Board and the Director of Healthcare Reform. Then next will be a report on the community engagement process for hospital system transformation. Then a blueprint for health per member per month payment increase recommendations. And then statutory changes needed to align prior authorization processes and requirements across insurers.
Art?
Just so I understand these, they're not highlighted in blue so that they haven't come in yet. Is that what that means?
The last time we checked the website was yesterday afternoon when we were updating this to see if anything else had come in. So
Okay.
as of yesterday afternoon,
They're
it had
not
not
in.
been posted to the website.
Okay, I thought they,
We did get the one from the Green Mountain Care Board. So if it hasn't been posted yet, it will be, and that should be in your email.
And so usually, well, oftentimes a report will be sent directly to the committee assistant or the whole committee or the chair, in addition to being sent to the legislative reports
okay,
email address. So there may be a delay when you get it versus when it gets posted through
okay.
along with the others.
I have a question on that. So if our committee assistant posts something on our committee page, does it automatically go to that reports and research?
It does not.
Okay, that's good to know. So let me take that one step further. In that process, would our committee assistant notify someone to put it on the reports page, or how does that,
I think they notify me,
they notify you?
yeah, and then it's already on the reports page, and then I take it from there and I upload it on our page.
What if it's the other way? What if we get it and they don't get it?
It's never happened, but I would definitely let them know.
Okay, you would let them know? Okay, great. Okay, thank you.
The next few reports are all from Act 180 of last year relating to nurse simulation laboratories. So Act 180 of 2022, the legislature required the Vermont State Colleges, Norwich University, and UVM to submit a report detailing the infrastructure and programming needs, estimated costs, and timeline to renovate or construct nursing simulation laboratories in order to expand student enrollment at nursing programs in the state. So you see, we were able to get a link for one of those reports, but have not yet seen the other two as of yesterday afternoon. Next is a report from the Agency of Human Services, nurse preceptors and nursing student clinical placement opportunities. This report identifies ways to increase clinical placement opportunities across a variety of healthcare settings for nursing students enrolled in Vermont nursing school programs. Next is a report from the Department of Labor and the Green Mountain Care Board. This is concerning process methodology and funding needs for performing healthcare supply and demand modeling. So this is a report on the process, methodology, funding amounts that are needed to establish and maintain the capacity to perform healthcare supply and demand modeling, which would be based on information in the Healthcare Workforce Data Center and would be used by healthcare employers, healthcare educators, and policymakers. And then next is a report from Department of Financial Regulation and Green Mountain Care Board, statutory changes needed to align prior authorization requirements across healthcare insurers. Health insurers.
And next two reports come from last year's budget bill. First, there's a report on mobile crisis outreach services. This was a status report in part on the experience of a Rutland pilot that was put in place, and also a status of the expansion of the urgent care model for mental health by expanding mobile outreach services. So that was a one-time report. And then there's also a section of the budget that required a report on emergency departments and patient experience of care. This detailed progress in the healthcare system and improving the patient experience of care of individuals encountering lengthy emergency department waits for inpatient psychiatric treatment.
And I'm sorry, because I know the mobile crisis outreach is important to some. That report is also delayed.
Thank you. Next, there is an annual report of the Emergency Service Wellness Commission, Provider Wellness Commission. This was one of the bills we talked about when Amron and I came in. There is a commission that was set up to address emergency service provider trauma when they arrive at a call. And so they're required to submit this annual report, and it's already been submitted.
And now we are looking into the future. These are reports that are not due yet. First, the Blueprint for Health Annual Report from the Department of Vermont Health Access.
Next, there was a report requested of the working group on services for individuals with eating disorders that has not yet come in.
Then the Agency of Human Services has a report on the use of funds appropriated to the designated and specialized service agencies for loan repayment and tuition. Then another report on the Agency of Human Services stakeholder engagement process regarding the all-payer model. And then the Agency of Human Services report on provider rate increases, which is about whether the fiscal year 2023 provider rate increase is having an impact on reducing wait times and resources and improving staff vacancy rates in a variety of settings. And then we have one last one, going all the way out to December 1st, 2023, delivery of healthcare services by audio only telephone in 2022 from the Department of Financial Regulation. You may recall when we were doing our overview of the acts from the last biennium that this is a new authorization to do audio only telephone services.
Great, dry but informative. So, and it's also confusing. So I want to be clear. I did call out a couple that we'll be taking up, but there are many on here that are vital to our work and how we work in our oversight of what's happening in the state and the healthcare system. So as we take up topics, I will do my best to remind you of the ones that will connect with a certain topic. Please don't hesitate to say, oh, I see this on the schedule. You know, are there any reports I should read beforehand? You might have to prompt me, but I'll do my best. And again, if you're looking for something in particular and you can't find it, if it's under AHS, let's use the resource Daisy told us about, but also please reach out to Peter and I, and we'll be happy to help figure things out. Any questions? Aaron or Katie?
I have a question for you.
Okay, well, hold on. So does it pertain to reports?
Yes.
Okay, go ahead.
And the reason I'm asking the chair is because it's not your decision. Like, so I didn't want to ask you. And I might have missed this, but like, can we like let you know if there is a report that we would like the committee to spend time on, and you look at how it could, because I think there's so much and it's hard to, even when you read them, sometimes it's hard to interpret. And so as I look through them, I might flag some and then ask you, and okay.
Absolutely, please.
Right.
That would be great because it's hard for us to get through every single one of them. So, go to what is your utmost interest and work back from there. And then, like Brian said, flag it for us to take up or connect it to the work that we're already doing. That'd be great.
Can I comment on it too?
Of course.
All right, you could say no, but I was writing an article related to passing AI legislation, and I discovered
What's
research,
AI?
artificial intelligence, and I discovered research showing that in state legislatures around the United States, like most reports don't get read or followed up on. And after seeing that, I've been trying to read them, and we really do produce a massive amount of reports in this body, not this committee necessarily. So I'm just being mindful of that we ask like staff to do all this work, and we need to, and I think Ann Donahue used to say this a lot, we want to make sure if we ask people to do work, that we actually read it. And I say that knowing I have a limited schedule and I'm going to do my best, but that's why I was asking, because there's no way we can get through everything in committee, but if there might be some things that we want to make sure we make time for. And I think that Vermont's legislature can try to do a better job than others.
I absolutely agree, and I have made it a concerted effort to try and do more as well. Even if it's reading the executive summary first and then deciding if I need to read the full report or go to sections of the next report, but at least to spend the time to understand what's happening, because at one point in time when we requested these reports, there was something we wanted from them. So, and the audio only one is so far out. I can't wait to get my hands on that report. So keep that in mind. And to Brian's point, do the best you can. So thank you. We're not done yet, committee, but thank you both and have a great rest of the day.
Thank you.
So there's just two things I wanted.
Before we go off reports.
Oh, yes, I'm
Sorry. Mari raised a really important report, the North report. And I don't know how to find it in here, but we maybe through AHS, and I don't think there was a link in there, but it was a really in-depth outside evaluator of the all-payer model and the ACO, and really worth the time to take a look at. But it's not easy to find. So
That's the one we asked Ina to get for us, correct? Okay.
she's going to send it. So I just wanted to flag it that. But it's also that there are tons of reports that are not legislatively requested.
Right.
And how do we sort of figure that out too?
Oh, right. So things that are happening in committees that necessarily don't have to. Right. So, and Leslie did send me a text on one of the working group ones. And so I will make an effort to find it and make sure you have access to it.
Because that link didn't lead anywhere.
Yeah. So again, just, send me an email, send me a text, and we'll figure it out. Anything else on reports? Dry, but important. So just real quick, two things. One, we, every year, there is Mental Health Advocacy Day in the State House. And every year, our committee works on a resolution for that day. I would say our committee. Brian normally works on a resolution for that day. And so I think Mental Health Advocacy Day is actually a Monday this year, the 30th of January, but we still want to put forth a resolution. Brian has offered to work on it again, and we thought it might be a great opportunity for a new member to work with Brian on how to do a resolution, how to get it through, or a member who has never done a resolution. So if there's anyone interested, reach out to Brian, and it's a quick turnaround time, but it's really, really important for our committee to get behind it. And then the second thing I mentioned the other day is we want to have committee liaisons for most of the committees. And what that entails is basically being aware of what's on their agenda. Are there things happening in their committee that affect healthcare or something we have jurisdiction over? A really good example would be last year, there was a lot of work done with Commerce on workforce development. There's been work done with corrections and institutions on getting us to where we put legislation forth for River Valley and building and moving the Middlesex folks to River Valley. So there are key things that don't necessarily come to this committee that are important for us to know, and or that are in another committee that we think maybe should do a flyby of our committee. So we're not gonna decide here. I would ask that you shoot me a text or an email of what you think you would wanna connect with if you're interested. We already have human services covered and we already have appropriations covered. So I would say the ones that are left are commerce, education, housing, government ops, judiciary, ways and means. We can keep a focus on ag because they do now have food resiliency, which is a social determinant of health. But that, that's not a high priority, sorry, ag. And transportation as well is probably not a high priority. So
People get hit by cars.
people do get hit by cars, yes.
We need that.
So I didn't count how many committees I just named and how many people there are, but it'd be great if everyone can take on the role and then just keep the committee apprised of what's going on in that committee if it's something that affects us. So just send me a text or an email and then we'll report back out who has what going forward. And if there are two people who want one thing, we'll duke it out. Alyssa?
No, I thought you wanted volunteers.
No, not yet. All right, I think that's it. So enjoy your lunch. We are back at 1:00 and we are doing Department of Mental Health Budget Adjustment Act. So let's get here a couple minutes before 1. This is really important. We have a deadline to get to appropriations and there are, we will hear from them today. We will ask questions. We will not make decisions today. That we will work through a collaborative committee process Friday or Tuesday. So please be here a couple minutes before 1 so we have enough time.